Assalamu alaikum. Myself Muhammad Ahmad. I have a topic of surgical management of pyometra in a miniature. So basically, it's a case study in which the case overview is we have a miniature saw 5 year weight 66.4 kg. The presenting complaint was abdominal distension, anorexia, lethargic, and the history was no previous medical issue on the farm, but decreased activity, lack of appetite from 2 weeks, defecation and urication was normal. The vitals of the animal temperature, heart rate, respiration was normal. During physical examination, abdomen was distended. After the CBC report, there is a total increase in the total protein level, and blood urea nitrogen level are also increased, but decrease lymphocyte and sodium chloride and phosphorus level. This is a biochemistry of the case. As in the picture, animal was standing, and you clearly know left side of the abdomen was distended. On the ultrasonography revealed that there is echogenic fluid in the uterine horn. And the clinician go for a pyometra as a diagnosis. Pyometra basically the uterine infection in which there is a accumulation of pus within the uterus. It may be open or closed. Pyometra. Next, we have the ultrasonographical image in which the echogenic fluid in the uterine horn, um, which was pus. This is near the blue arrow. The predisposing factor of pyometra was bacterial infection, postpartum complication, endometritis, age, and parity. Then clinician go for treatment in which he used antibiotic and said rehydration solution, and for sterilization purpose clonazepam. Next further condition is life threatening in which abdomen was distended, no vaginal discharge, or pus is trapped inside the uterus, which causes the possibility or probability of a bacterial infection. So go for ovariohysterectomy, which is also known as pain, used to control disease such like pyometra and cyst. As we know, this was the surgical management of pyometra case. So anesthesia protocol was used, which composed of alprazolam, ketamine, propofol, isoflurane, morphine, bupivacaine, and epidural, hypertonic saline. These are the drugs which are used in the anesthesia protocol. Next surgical procedure in which saw was placed dorsal recumbency, prepare aseptically, and drap was placed from the 5 to pubis. 15 cm incision was given. Skin and adipose tissue was exposed. Then left and right ovarian pedicle was ligated. During the surgery, there is a small tear in the left uterine horn, which was completely levi through the normal saline and handle at that time. At the end, go for the closure and abdominal wash with the 5 liter normal saline. Then in post-operative care, uh, clinicians use morphine, ceftiofur, flunixin, meglumine, amoxicillin, and IV for the sportive purpose. The culture was performed after getting the intraoperative uterine fluid, and E. coli and Shigella hypovaginalis and Trupella abortus bacteria was identified. Then we have a learning point of this case. As we know, pyometra is a case of pus accumulation. This may be count up to 25% body weight of the animal. Don't confuse pyometra with the pregnancy and obese animal. Then it's a surgery, and you should have a plan for any contamination or rupture of infection in the during the surgery. And you should follow all the anesthetic protocol in the surgery or before the surgery. After surgery, there a condition of hypotension and constipation may occur. So you should have a plan to cope with these issues. Thank you.